When you have found out that you are pregnant, you might want to think about who you wish to provide your care and where you're going to have your baby.
You should be able to choose which kind of health professional is mainly responsible for your care. It could be a midwife, an obstetrician or a GP. It's important that you get on with the person providing your care, and you are entitled to change your doctor or named midwife if you wish to. Currently, 99% of babies in Britain are born in hospital. Most of those, about 80%, are delivered by midwives who are trained to deal with all aspects of normal pregnancy, birth and the postnatal period, and to recognise any medical problems needing the help of a doctor.
Every woman has the right to have her baby at home if she wishes. If you do, your baby will be delivered by a community midwife or independent midwife, or possibly a GP. If you find later on in pregnancy that you would prefer a different maternity care package, you can talk to your midwife and/or GP. Changes in the organisation of maternity services mean you should be able to change your mind later on if you want to. You may be worried about your financial situation with the extra expense of a baby. When you first see your midwife, GP or the hospital about your pregnancy, you can ask for a copy of the Maternity Services Charter, which explains your rights in pregnancy. You can get details about all the benefits and allowances you may be entitled to from your local Department of Social Security.
It would be nice to have your child in your home, and that's okay for people if they feel confident. Pregnancy and childbirth is such a personal thing, and I think whatever way people want to do it, that's down to them. It's their choice. But at the end of the day, if you've any fears about childbirth, I would say go for a hospital, because it's not horrible and clinical. They made us comfortable. Anything we wanted was okay. To me, it was better than being in the home because we were made to feel at home.
I mean, I assumed, because it was my first, I'd have it in hospital. But talking to the midwife, she said, what about home birth? I was quite astounded. I think we sort of thought because it was our first that we wanted to have him in hospital.
You and your partner can make choices about the maternity services on offer and how to give birth. You may go to NHS antenatal classes at the hospital or your health centre, or to NCT classes, or indeed both. If you decide to do NCT classes, it is still worth considering hospital classes as well, as you will learn about the hospital's policies on various aspects of your care. Antenatal classes are a great way of getting ready for your baby's birth. They offer information about pregnancy and labour, birth and the postnatal period. You'll have the chance to try out some positions for labour and develop relaxation and breathing techniques. There will be information on such things as the different methods of pain relief, local hospitals and the way baby may be monitored. Antenatal classes can also help you to think about and prepare for looking after your baby.
Do you feel pressurised anyway from the way work
It was very informative and it was quite enjoyable. I think we had a good group of people there. Everything I think I needed to know I learnt on the course. We covered all sorts of feelings and emotions.
You can get rid of all those silly little questions that you don't like to ask your GP. You can say, or what happens if it comes out toes first, or they ask the things that you might possibly sort of think about, but generally as the group goes on you get to cover absolutely every aspect of it.
You can rehearse all sorts of possible scenarios that may occur, and you can share your feelings and experiences with other future parents. Many people make friends here and stay in touch for years.
Tense and relaxed muscles.
NHS antenatal classes are usually run by a midwife and last from 6 to 8 weeks. They are free of charge. NCT classes are rather different. The emphasis is on informal discussion with NCT teachers who are always parents themselves. Of course, you may decide not to go to any kind of antenatal class, or you may wish to go to a woman-only class. If you're a single parent, you're welcome to join a couples class with or without your birth partner, or you may want to see if there's a class for single mothers.
There's the continuity there, yeah.
I think you want to feel in control, and the more you know about a situation, and the more in control you can be, and it's important to be informed. And also, there are quite a few choices to make in pregnancy and delivery.
Yes.
And you want to be as informed about them, as knowledgeable as you can be.
A few of our friends have got children, and so it's like a bit like going to the unknown. It's not just for information, but it's sheer panic and fear as to what's going to happen to you, and also kind of wanting to find some other people who are in a similar situation.
Yeah. I mean, I haven't started classes yet, but I will be. And I think when it's your own, it's a totally different ball game, and you're responsible for this little thing.
Yes. 24 hours a day, 7 days a week.
And it's frightening. So the more information you have, the better you'll be, I hope.
These early weeks, when you either suspect you may be pregnant or have just had your pregnancy confirmed, can be very special. You may find yourself feeling excited, apprehensive, happy, resentful, proud and incredulous all at the same time. Some people feel more relaxed when they pass the 12-week point, because the chances of a miscarriage are much reduced. Changing hormone levels can create emotional ups and downs. You might feel a delight as well as fear about what you may have let yourselves in for. This is all quite normal. Many people find they are thrilled one minute and anxious about the future the next.
You know, I'm not really worried.
There may be major emotional changes happening to you in your own various relationships at this time.
I'm really pleased you're pleased.
Your partner may feel left out of this stage of pregnancy, yet caught up in your heightened emotional responses. It can help to talk about problems. You may experience a deepening of your relationship.
It's strange because you're really happy about sort of the baby and having a baby, and especially, you know, when it's planned and that's what you want and that's what. But there's another bit that you feel like you're losing part of your life. And like certainly to go from working and a good job and know that it'll never be the same, and you can never have the same kind of job or even the same kind of life, and your lifestyles are going to change radically, and that you definitely regret bits of that.
I find for me, I'm young, I'm only 21, and being a young single mother, I've had to suddenly grow up overnight. It's, you know, my friends are still, you know, students, or they're starting out in new jobs. They're going out to the pub, they're going night clubbing, you know, they're going on holiday. And all this is suddenly stopped for me, and it's an overnight process. And I've lost something. It's almost, I've slightly lost some of my youth. You know, I've had to grow up desperately quickly and accept the responsibilities of being a mother, taking responsibility for somebody else. You know, I'm so used to having so much fun doing what I like when I like, and I'm like, suddenly all this has stopped and I have to be responsible, grow up, be mature. It's, you know, and I found that very frightening. I mean, now it's much easier, and I've sort of grown to accept it, and it's not a problem anymore. But to begin with, it was a very difficult thing to come to deal with.
Going to get... Yeah, well, there's nothing there now. I mean, I'm only pregnant 2 months, so it's about this.
Many women spend a lot of time worrying about keeping their weight and shape under control. It can feel as if suddenly there are lots of things happening to your body that you have no control over.
You know, the fluids.
It's important not to worry about your weight. Women are usually weighed every antenatal visit, but there's actually no direct relationship between your weight and your baby's development.
Right, the first one was 8.
It should be okay.
You and your partner may want to discuss your feelings. What are his expectations and hopes? Does he feel comfortable about the idea of coming to antenatal classes? Does he want to be there at the birth? If he is there during labour, he can give you lots of support and act as a go-between, talking with hospital staff. If he decides he doesn't want to be there, you may want to ask someone else, perhaps a close girlfriend. Above all, it's important that you both feel comfortable with your decisions and that neither of you feels pressurised.
Most people have heard of postnatal depression, but some women suffer a sort of depression in the weeks leading up to the birth, which is sometimes called antenatal depression. It's nothing to do with whether you want your baby or not. It's thought to be a combination of hormones and all the questions going round in your mind that you can't answer. One way of dealing with this can be to talk about it with someone who will listen, your partner, a friend, or perhaps a relative.